My name is Won-jae Lee from Seoul National University Bundang Hospital. I'm an interventional cardiologist and working at International Healthcare Center to help patients from abroad. Today I'm going to talk about hospital preparedness and the new normal for medical tourism in COVID-19 era. I'll start with the current situation of COVID-19 in Korea and move on to in-hospital management of system, and also talk about reactivation of medical tourism and finish with the introduction of a case. So first confirmed case of COVID-19 in Korea was in January, and in February actually there was a huge outbreak called Shincheonji outbreak. We almost had 1,000 cases a day, but luckily we were able to go through with a successful management. After that, we were able to manage a daily case about 50, but in mid-August we had a second wave again, having around 400 cases a day. But luckily again, for now, we have a daily new case of 15, and up until now we have done more than 2 million tests, and we have a confirmed case of 24,000 by the early October. So this is what we did after outbreak of COVID-19. We rapidly set up more than 600 spots across country by public and private sectors. So some of the pictures shown here are real screening center that was set by private and public sectors. And I think this is already pretty much famous, the drive-through screening center. This was very effective for screening, and at the same time limits exposure of frontline workers and the patient at the same time to the virus. And if you go into KCD website, you'll be able to see where they are, and there are actually about 70 spots set up in Korea. One of the most key factors that we were able to do successful fighting with COVID-19 was that we had a fast introduction of diagnostic kit. With the first case of confirmed COVID-19 in Korea, one of our private company were able to develop in just 3 weeks. And more importantly, our Ministry of Food and Drug Safety approved this kit in just 1 week. Actually, these kind of devices take 6 months or sometimes a year to get approval, but after MERS, we have set up expedited approval process, and we were able to do it in 1 week. So by the end of February, we were able to do more than 20,000 tests per day. With this tool, public health sector conducted thorough contact tracing with a lot of systems. For example, using GPS, DUR, credit debit card user data, government was able to trace and find out where patients were and who were the contact person of the patient. Of course, there are private issues, and this is done under the law of Infectious Disease Control and Prevention Act, which was also set after MERS era. We have restructured medical facilities. So to handle a lot of COVID-19 patients, we transformed some of our public hospitals only for treatment of COVID-19 and call them National Infection Control Hospitals. Also, we have designated some hospital as a safe hospital to maintain routine clinical care while separating patients with respiratory symptoms who are suspicious of COVID-19. And of course, we have expanded negative pressure facilities to treat COVID-19 patients. These kind of outbreaks often overwhelm a lot of medical facilities. So we had to set up community treatment center where we can manage and treat mild COVID-19 patients. So for example, patient who can discharge from hospital but with PCR positive patient, or patients do not have severe symptoms but who have comorbidities who need screening. So we have treated these patients in non-medical facilities called community treatment centers. So this is one example. We actually helped our local government to set up this center and also run this facility. So the left tile you see the hospital. This is our commanding center in our hospital, and down left, down right, you can see the non-medical facility where we ran operating facility, and through telecommunication, we provided necessary patient care. So when patient is diagnosed with COVID-19, they're going to send to either public or private hospitals, And if they have severe and clinical unstable, they're going to send to our tertiary hospitals such as SAUBH, where we have high-level isolation units with capability of ICU care. And when these patients are treated well and get better, they're going to send to community treatment center or will be sent home. So now move on to hospital management with a little more detail. So Seoul National University Bundang Hospital is one of 6 hospitals designated by the government. So the definition is patients with respiratory symptoms are isolated from the other patient during the entire care process. So to do that, so this is the overview of our hospital picture, and we have 2 main buildings, and just right outside of our first building, we have set up COVID-19 clinic. And right in front of our ER, we have ED triage, which also works as a screening center. And we have isolated high-level isolation units. Also, we have another isolation unit in our hospital. So this is the whole process when patients want to visit our hospital. Basically, we send out pre-screening questionnaires by SMS, and when they come to our hospital, they're going to issue a QR code, and using that QR code, they can enter our hospital. So this is a picture of our hospital lobby, and right outside of the entrance, there is a QR code info desk where they can get information on how to use this QR code. And as soon as they enter our facility, you can see that they get QR code scanned and also get temperature at the same time. And if they, according to their symptoms or epidemic status, they are triaged and they're going to be able to pass, or they will either sent to some of our facilities for further care. So this is a picture of our kiosk where we have a QR scanner, and right next to it we have a temperature check machine. So if a patient has no problem, you see the blue light so they can pass, or if there are further needs, they're going to have red pass, and they're going to send to either of our facility for further care. And this is down there you can see the example of temperature result. And this is the flow chart for our triage. So basically, as I explained earlier, they're going to be screened. All the patients coming into our hospital will be screened at the gate. If they have symptoms, they're going to either send to COVID-19 clinic, or if they have risk factors, they're going to send to ER for further triage. And if they need admission, they're going to send to either our facility for further care. This is a detailed chart for COVID-19 screening. So basically, if somebody has a risk factors or symptoms, and they're going to get COVID-19 RT-PCR and will be sent home. But if not, they can get issued confirmation, and then they can get further care. And in case where they just need prescription refill, they can just get it there and return home, or they can get into our main building and get outpatient care as planned. This is structure of our COVID-19 screening. So right outside of our hospital building, we have 2 clinics, also X-ray machine and waiting room. Of course, all the rooms are negative pressurized. This is our PPE principles for COVID-19 screening clinic. So for example, down left, the registration is a little bit lighter, but when they need specimen collection, they need to do full PPE. Which is level D. And there is triage in front of our ER as well. So this is 24 hours clinic center for high-risk patient. So if they're not suspected of COVID-19, they're going to use normal ER and as get routine care. But if they are suspected, they're going to send to our isolation area. And this is the picture of our isolation area. And in this area, you have to be using level D, using N95 respirator, gloves, gown, and facial shield as necessary. And there are patients who need admission. So for confirmed severe cases, we're going to have them in high-level isolation unit with negative pressure. If they're moderate and they're confirmed, they're going to send to another isolation unit. If they're coming here for pneumonia or unknown cause, or they don't have symptoms but only epidemic risk for other reasons, then they're going to go to preemptive isolation units. So I'm going to detail a little more in the next slides. So this is a picture of our high-level isolation unit. and this is actually designated by government. So this is completely separate from our building so that there can be no transmission in hospital. And then in normal times, we have set up this for a new emerging disease like Ebola or MERS or other kind of fever. For now, we are using and dedicated for COVID-19. This is pictures of high levels unit. You can see the central monitoring. Also, we have a very big room with negative pressure, and you see the ventilators there. But there are a lot of patients with further care like ECMO or CRRT, and this room is capable of equipping all of these machines. An example of PP Downing room and docking room is down there. And this is another unit for more moderate cases. So this was actually opened because of the number of cases, confirmed cases increased, so we had to open new one. And then using negative pressure machines, we have added more negative pressurized wards in this area. And there are patients who have an epidemic risk or high risk for COVID-19 but need other care. So when these kind of situations happens, we put them in this ward and we have them here for observation during incubation period. And while staying here, of course, we're providing all the necessary care like CT or MRI as necessary. Since we have this system to separate the high-risk patient or confirmed cases of COVID-19, so in our face-to-face consultation, actually there was no dress change, but we had a more emphasis on principle. So there was no change in consultation time or setting, but doctors and patients are all wearing masks all the time and use hand sanitizers, and definitely there was more frequent hand washing after treating patients. And there are cases that we might fail to screen the high-risk patient, and when that happens, we have a EMR system that can alert a high-risk patient, and then when that happens, we're going to contact infection control team immediately. And of course, we are conducting regular decontamination of public spaces by specialized companies as shown here. How about management or in-hospital staff? So every day our staff get electronic questionnaires asking about their symptom status or they have been to high-risk areas. And these are some of the examples of our SMS message. And if there's a new instance or there's new instruction that's message that need to be sent, we're going to use this system to share with all of our medical staffs. And the picture you see here is an example of our cafeteria, and you can see the blocking panels so that we can minimize the transmission even between meals. And also, we have transformed all the conference and meetings to teleconference system. And definitely we're imposing stricter social distancing for our healthcare workers. We have expanded our education for donning and doffing PPE for a broader population of our hospital staffs. And we are doing simulation for CPR, and we are actually doing transfer simulation. So now we are providing more education to our healthcare workers using providing more PPE education and broaden the population. And also we'll do simulation for CPR and transfer of patients as shown here, and we are actually implementing these measures in our hospital as when needed. So now I'm going to move on to the medical tourism a little bit. So we all know that there's a drastic decrease in tourism. In Asian and Pacific, there's a 35% decrease in international tourist arrivals. And in the world now it's down, it's more than 22% down, and I think it's more drastic at this moment. So a lot of experts about medical tourism and tourism thinks that it's going to be we will able to restore international tourism by second half of 2021, but for medical tourism patients who are in need of medical care, can we wait, or should we really wait for post-COVID-19? I think that's not easy because it's definite that there is a cross-border and asset disparity of healthcare, and which has led to medical tourism across the country. So we believe that we have international obligation, since having an excellent and efficient Korean medical system, we feel that we are obliged to provide these people who are in need, and also education, and we need to knowledge sharing, and we need to provide service as necessary. So we think that we need to activate medical travel even in this COVID-19 era. But yes, there are risks and concerns. Still, there are a lot of new cases happening around the world. So incoming foreigners may be viral vectors and can be source of COVID-19 transmission, and this can lead to possibility of in-hospital transmission. However, we do have a great tools. By enhancing hygiene, which is hand washing, and do more screening, and keeping social distancing, and wearing masks, all those methods are very helpful to minimize the transfer of COVID-19, and which can helpful to restore our daily life. So the virus is there, but if we take these measures, I think we can definitely strategically decrease transmission rate, and we can resume our medical tourism. So this is our strategy for International Healthcare Center. So we communicate with our customers who are patient and referral agent and insurance companies more often and more in detail. So we share with them our current SNUP policy for COVID-19, and also at the same time current status of Korean government on medical travel. And we have adopted new policies and set up new protocols using a lot of checklists. And we try to familiarize our patient with SNUP status for manpower, or bed status, and other COVID-19 related resources. And of course, we're thinking about utilization of telemedicine at the moment. So there has been much change, but big change would be the quarantine. So if you come to Korea and want to get medical care, you will need 14-day quarantine. However, if you are in emergency situation and you cannot wait for 14 days, there are some ways to mitigate these 14 days, and with help of our IAT staff, we can find a way. So what we are doing right now for pre-arrival is we are doing more and more online communication of Korean medical condition by coordinators and Internet Healthcare Center medical doctors. And we are doing more and more equity assessment and certification so that patient can get necessary care right away when they come to our hospital. So proactive communication and accurate information is very important for pre-arrival for medical tourism patients. When they come to Korea and they want to visit SNUPH, there is one procedure that needs to be done. If they have already done 14 days of quarantine, then it's okay. They can just get usual care just like other Korean patients. But if it's less than 14 days, then you need to discuss with our staff. Then we're going to talk with our regional public health officers for your visit, and also at the same time, we're going to talk to our infection specialists and the specialty doctors so that you can get care right away. And definitely telemedicine is a very good tool for medical tourism at the moment. And as you all know, United States and European countries, Japan, China, they're actively adopting and growing telemedicine, and this market is very huge. And our hospital also is preparing a telemedicine tool to provide for medical tourism patients. So I'd like to summarize my talk with introduction of a case that recently had. So this is a 7-year-old Russian boy with advanced cancer. Why he needed help? He already went through multiple surgeries, chemotherapy and radiotherapy and more in Russia and China. He was recently treated in cancer hospital in China, which is pretty famous, but was recommended to go home as there is no available treatment. However, this young boy, patient mother, strongly wanted a second opinion, so she contacted our staff of SNUPH for help. After hearing about his story, me and our staff consulted with oncologists, and luckily our oncologist decided that we're going to evaluate this patient again in SNBH and to seek further solution. So we communicate with the mother of patient, and patient was luckily arrived at Incheon airport safely. And of course, as I explained earlier, he needed 14 days quarantine. However, patient complained severe pain because of cancer, so they asked for our help. So the control center actually contacted our center as well. So our staff and our specialists and the infection team, we sat together and we had a discussion. We concluded that patient need urgent admission, and the infection team recommended to use preemptive ward. So patient visited our ER and sent to the isolation area, and right after that transferred to preemptive ward. In preemptive ward, while waiting for COVID-19 result, we conducted a lot of tests, CT, MRIs, and after COVID-19 was negative, he was able to get care he was needed. So this is our multidisciplinary team discussion, and luckily we have decided to retry chemotherapy and radiotherapy, and you can see down left the tumor much decreased after a few months, and more importantly, patient is now free from opioids, narcotics, analgesics, which he was heavily on before coming to our hospital. So Seoul National University Bundang Hospital is the world's first and bestest hospital, and actually we are the first to achieve HEME stage 7 outside the US. And we are the hospital where doctors want to visit and learn, and you can see a lot of pictures here. We are accepting a lot of doctors around the world, and we are providing education. And not just medical education, we are also doing a Leaders Academy, such as Moscow CEO Leaders Academy and Nursing Leaders Academy, where we provide hospital management details. So we think that we are prepared to share our knowledge and our experience with fighting with COVID-19, and we are ready to share with a lot of people, countries around the world. So I think that we cannot just wait for post-COVID-19 for medical tourism at the moment. Maybe we have to live with this new normal, new facility like screening centers, 14 days quarantine, and PPE during the medical treatment. With new tools and new systems in place, I think we can effectively treat patients in this new normal COVID-19 era. Thank you.